Not all fractures need to be healed on an x-ray before you release the patient into the wild. The best example of this would be an avulsion fracture off the base of the fifth metatarsal. This injury can be quite painful, can present with significant swelling and bruising and disability, but ultimately, in many cases, the patient heals first before the x-ray does. I just had a patient today that we were treating actually a few years ago with an avulsion fracture out the fifth metatarsal base, and his last set of imaging, it actually wasn't completely healed. Case in point, he came in today for a completely different issue, which did still require x-rays, and coincidentally I was able to see the site of the prior fracture, and it was actually completely healed at this point. So I'll see in a lot of patients, they've been provided advice for particular injuries where they've been told they need to wait and keep wearing that boot and keep going to physical therapy, and you can't get back to running yet. It's just excessive. I think there can be just as much harm with something that's non-surgical, like a boot. Immobilization, you see atrophy of soft tissues, decreased bone density. It can cause significant amount of harm, not to mention the mental health implications as well. So in these cases, you really need to take a holistic approach, identify injury, corroborate that with imaging, and ultimately, depending on the injury, if the patient's ready, we can release them back into the wild and not wait for that x-ray to heal, because it's going to take a long time.